Hello everyone, my name is Dr. Rick Harrell. I'm the Program Director at the Georgia School of Orthodontics in Atlanta, Georgia. Today I would like to discuss with you a Georgia School of Orthodontics clinically based fellowship that we're going to offer in Malaysia beginning in 2023 and extending into 2024. A little bit about myself. I am a 1979 graduate of the University of Alabama School of Dentistry. I served 3 years in the Indian Health Service in Northeast Arizona in the southwestern part of the United States, and then returned to UAB to do my ortho residency from 1982 to 1984. In 1984, after completion of the residency, I moved to Westminster, Colorado, and practiced in a private practice setting for 22 years. In 2006, I became an educator at the University of Colorado, eventually becoming clinical director, and in 2015 took over the program at Medical University of South Carolina as program director, and then in 2017 came to the new school here in Atlanta and have remained ever since. Our school is very much interested in helping train dentists all over the world, and the purpose of this fellowship is to enable general practitioners the opportunity to learn how to safely pick and choose and execute orthodontic treatment for their patients. It is not to turn you into an orthodontic specialist, but yet give you some very good basic tools to help you in the treatment of your patients. It will be a non-cephalometric based course with the approach to diagnosis, treatment planning, and execution of treatment. It is designed to allow you, the general dentist, the background to pick patients to treat that can be treated with minimal risk and the greatest success rate. It will also clearly demonstrate which cases are beyond simple orthodontics and should be referred to a specialist for treatment. The course is going to be given in Kuala Lumpur during the 2023 and 2024 calendar years. It will consist of 4 week-long sessions given in person by myself, and we will be there 1 week per calendar quarter. Prior to the course, before you ever start taking this course, you will be sent a 12-module preparation online course to give you a basic level of understanding of orthodontics that you can review and then assess yourself on the material that's presented. Along with the pre-course modules and the 4 weeks of in-person lectures, each participant will be allowed to submit 2 of their own cases for close supervision during the course and after the course ends. So part of our coursework after we do the first week, the very first day, when we come back in for that second, third, and fourth week of the course, we will sit down and discuss cases that you, the participant, have started and are actively working on in treatment. At the end of the course, each attendee will receive a certificate of completion of a clinically based fellowship from the Georgia School of Orthodontics. You will also receive about 120 hours of continuing education credits through PACE, which is the accrediting body for continuing education through the Academy of General Dentistry here in the United States. The registration and payments will be made through the Georgia School of Orthodontics website, and the cost of the virtual pre-course instruction, materials for hands-on use in the course, and the 4 weeks of in-person lectures and the consultation for the 2 patients started during the course is $25,000 USD payable to Georgia School of Orthodontics. So my question for you in the audience is this: would you like to be able to change this into this? How about this into this? This into this? You'll be able to do that at the completion of this course. The curriculum is designed to ensure that you, the attendee, will be able to identify those cases which will be treatable by a general practitioner and have the clinical skills to successfully achieve the desired outcome for both the patient and you, the practitioner. As I stated earlier, the curriculum will be non-cephalometric based. We're going to base our diagnosis on what we see intraorally, as well as using some of the landmarks of the head and the soft tissue of the face. The attendee will be able to produce appropriate diagnostic materials to safely treatment plan the patient. And you'll also be able to assemble those diagnostic findings and develop treatment objectives as well as an appropriate treatment plan for your patient. So let's take a look into the future. So before this course ever starts in person, you will be given access to the Georgia School of Orthodontics Benchmark course. These are baseline knowledge lectures that we feel everyone should know and understand before entering the actual in-person course. And these are the topics that will be covered during this baseline course. Early growth and development, the different types of bone formation, different types of bone growth, the embryology of the craniofacial complex, some theories of growth control, growth of systems and assessment of growth, development of the dentition, the classification and etiology of malocclusions. We'll touch a little bit on cephalometric radiology, but not for our diagnosis and treatment planning. We'll talk about space management of the dentition, orthodontic versus orthopedic treatment, and orthodontic treatment basics. At the end of this pre-course lecture series online, you'll receive a quiz that will enable you to assess your knowledge in these areas at the end of the pre-lecture course. What about when we get into the course? What would the first week look like? We plan to have it in Kuala Lumpur on May the 29th through June the 2nd of 2023. The first day will be spent discussing the different classifications of malocclusions, Class 1, Class 2, and Class 3. It's not just about molar relationships. On day 2, we'll talk about the diagnostic process, hard and soft tissue analysis, the different head types, which really plays into our orthodontic treatment planning, and the ideal patient selection. What kind of patient would you choose to help you achieve success in your orthodontic treatment? On the third day, we'll talk about edgewise appliance systems. We'll talk about traditional edgewise versus self-ligating. We'll also cover some biomechanics. On day 4, we'll cover the 6 stages of edgewise treatment that we encounter from a start to finish treatment regimen. On day 5, we'll look at the different types of treatment for the different types of malocclusion. We'll talk about anchorage, and we'll also do some typodont exercises where you will take some edgewise brackets that we will provide as part of the course and bond them to a typodont and insert arch wires and kind of learn your way around the edgewise bracket system. So you'll be able to produce something that looks very much like this. All right. What about week 2 of the curriculum? This will be August 14th through August the 18th, 2023. The first part of the week, that first Monday morning, we'll start with our reports on patients that are started by you, the attendees. And we're going to talk in detail about Class 1 cases with crowding, spacing, and some vertical issues. On day 2, we will talk about the extraction versus the non-extraction debate. And we're going to fully explore this to dispel some of the myths about tooth extraction in orthodontics. On the third day, we'll talk about some of the extraction patterns for Class 1, Class 2, and Class 3 malocclusions. On the fourth day of the second week, we'll talk about molar classification with treatment, both Class 2 and Class 3 treatment modalities. On the fifth day of that second week, we're going to talk about Class 1, Class 2, and Class 3 developing malocclusions and how we can treat those before they become full-blown complex orthodontic cases. So how would you like to be able to take a youngster that looks like this with this significant amount of overjet and a retrusive mandible, do a little treatment, and have them look like this at the end of treatment with a nicely reduced overjet, normal depth of bite, good profile? You'll be able to do that at the end of this course. On the third week of the curriculum, which would be November 20th through the 24th, 2023, again, we'll start the week with progress reports on the patient started by you, the attendees, and we will talk about bracket repositioning. We'll also talk about the myriad of arch wires that are out there and how the arch wires can really help you with treatment. And we're going to try and we'll have a very simplified arch wire progression sequence in a course like this. On the second day of the third week, we'll talk about methods of space closure, how to finish the case, what to do about retention. We'll do some wire bending exercises so you can fabricate some of these retainers in your own office and practice. On the third day of the third week, we'll talk about debonding, retainer placement, how to manage diastemas post-treatment. On day 4, we'll talk about the aligner therapy, Invisalign or any of the other myriad of aligner companies that are out there, but they all work on the same principle. And then on the 5th day of the third week, we'll talk about something that's really new and interesting in orthodontics, the BRIAS system. We'll also talk about some of the other technology that we can access now in contemporary orthodontics. So space closure would be taking something like this, and through the magic of wires and brackets and elastomerics, turning it into an arch that looks like this at debond. The fourth and final week of the curriculum will be March 25th through the 29th of 2024. Again, on the first half day, we'll talk about progress reports on patients started by you, the attendees. And then I'm going to talk about the 12 most common micro and macro mistakes that we make in edgewise orthodontic treatment. On the second day, we'll talk some about the management of impacted teeth, canines, other impactions, and we'll also talk about this idea of tooth substitutions that we sometimes are forced to do in orthodontics. On the third day, we'll talk about diode lasers in orthodontics as an adjunct to our orthodontic treatment, especially in the finishing stage. And hopefully we can have some hands-on exercises there at the lecture facility in Kuala Lumpur. On day 4, we'll talk about the use of mini screws for anchorage in orthodontics and how they can be incorporated into orthodontic treatment. And on day 5, we're going to have kind of a summation of everything and have a day spent doing treatment planning exercises using the principles we were taught in this course. And I will bring cases for us to treatment plan, and I can also show you how they all finished as well, so that we'll give a great deal of credibility to our teaching method. We'll also award the certificates from the Georgia School of Orthodontics at this time as well. So you'll be able to take a patient that looks like this, turn them into a patient that looks like this, which creates a big smile that looks like this, and you'll get a certificate to take with you back to your home office stating that you've completed this fellowship in clinical orthodontics through the Georgia School of Orthodontics. So this, to sum it up, is a course that's designed to give you some clinical judgment and the skills necessary that you can utilize in orthodontics. It is not a course to teach you how to glue brackets to teeth without any knowledge of what happens afterwards. It would be my pleasure to have you as students and to watch your progress through this course. And some of you in the audience may even be inspired by the joys of orthodontics to pursue it as a specialty later in your practice career. So I hope to see you all in Kuala Lumpur in 2023 and 2024. Again, my name is Dr. Ricky Harrell. I'm the Program Director at Georgia School of Orthodontics, and we will be posting further announcements about this in the appropriate social media for all of you. Thank you, and I hope to see you next year.